Why does this tiny corner of my toenail hurt so much? If you ever had an ingrown toenail, you know exactly what I'm talking about. That excruciating, throbbing pain that makes it impossible to wear shoes, walk normally, or sometimes even have a bed sheet touch your toe at night. Most people think ingrown toenails are just minor inconvenience, something you have to deal with at home with some warm water and hope for the best. But here's what they don't realize: that minor ingrown toenail can quickly become a serious infection that requires emergency treatment, antibiotics, or even hospitalization. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. In my 25 years of practice, I've seen ingrown toenails in patients from 6 months old to 96 years old. I've treated simple cases that resolve with minimal intervention, and I've treated severe infections that require aggressive surgical treatment. The tragedy is that most ingrown toenails are completely preventable. And when they do occur, there is now treatment options that can resolve them permanently and without the pain and downtime of traditional surgery. Today we're going to cover everything you need to know about ingrown toenails, why they happen, how to recognize them early, and most importantly, how to prevent them for good. This is the third module in our Toenail Health 101 series, and by the end, you'll never have to suffer with ingrown toenail pain again. But first, if you want to learn how to prevent and treat foot problems before they become serious, hit that subscribe button and ring the notification bell. I share proven strategies for foot health every week, and you don't want to miss them. Also, follow me on social media. The links are in the description. I've written a comprehensive book about toenail health that includes detailed prevention and treatment strategies for ingrown toenails. You can get it absolutely free at www.mytoenailbook.com. The link is right there in the description below. Let's start with the basics. What exactly is an ingrown toenail? An ingrown toenail occurs when the corner or side of your toenail grows into the surrounding soft tissue instead of growing straight out over the skin. While it can happen to any toe, the big toe is most commonly affected because it bears the most pressure and is most likely to be squeezed by tight shoes. Here's the simple anatomy. Your toenail grows from the nail matrix, which is located under your cuticle at the base of the nail. Normally, the nail grows straight out over the nail bed and extends beyond the tip of your toe. But when something disrupts this normal growth pattern, the nail edge can curve downward and penetrate the skin. Once the nail pierces the skin, your body treats it like a foreign object, which technically it is. This triggers an inflammatory response with redness, swelling, pain, and potentially infection. Now let's talk about what causes ingrown toenails, because understanding the causes is the key to prevention. The number one cause is improper toenail trimming. I see this in my office every single day. People think they're being thorough by cutting their nails in a curved shape to match the shape of their toe, or they cut deep into the corners trying to remove every bit of nail they can see. Here's what happens. When you cut the corners of the nail in a curved shape, you're essentially creating a sharp point that's aimed directly at the surrounding skin. As the nail grows, that point grows right into the flesh. When you cut too deep into the corners, that's what I call bathroom surgery. You're removing the part of the nail that should be protecting the skin. The remaining nail edge becomes a sharp spear that grows into unprotected skin. Shoe pressure and trauma are the second major cause of ingrown toenails. Narrow shoes that squeeze your toes together put constant pressure on the nail edges, forcing them to grow in abnormal directions. High heels are particularly problematic because they push your toes forward in the narrow toe box of the shoe. Sports-related trauma is incredibly common. Runners, soccer players, tennis players, anyone whose toes repeatedly hit the front or top of their shoe are at high risk. Each impact creates microtrauma that can alter the nail's growth patterns. Acute trauma, like stubbing your toe or dropping something heavy on your foot, can immediately damage the nail and nail bed, leading to abnormal growth. Genetics and nail deformity play a bigger role than most people realize. Some people are simply born with nails that are too wide for their nail bed. When the nail is wider than the space it has to grow in, the edges have nowhere to go but into the surrounding skin. This is often hereditary. If your parents or grandparents had ingrown toenails, you're more likely to develop them too. Curved or involuted nails, nails that curve naturally inward like a tube, are another genetic factor. These nails look normal when they're short, but as they grow longer, the curved edges can dig into the skin. Let's talk about symptoms to watch for, because catching an ingrown toenail can save you a lot of pain and prevent serious complications. Early symptoms include tenderness along the nail border, usually just on one side initially, slight redness around the nail edge, mild swelling of the surrounding skin, pain when pressure is applied, like when wearing shoes. This is the time to take action. At this early stage, conservative treatment can often resolve the problem completely. Advanced symptoms that indicate the problem is getting serious: intense throbbing pain that keeps you awake at night, significant swelling that extends beyond the immediate nail area, bright red skin that feels hot to the touch, pus or drainage from the nail border, granulation tissue, red bumpy tissue that grows over the nail's edge. When you see pus, red streaking, or granulation tissue, you're dealing with an active infection. This is not something to treat at home. You need professional medical care immediately. Here's why infections are so dangerous. The toenail is very close to the bone, and if the infection spreads to the bone, it becomes a much more serious condition called osteomyelitis. This is particularly dangerous for diabetics who may not feel the pain due to neuropathy, and whose infections can spread rapidly. Let's discuss home remedies, when they can help and when they can make things worse. Warm soaks can be helpful in the early stages. Soak your foot in warm water with Epsom salts for 15 minutes, 2 to 3 times per day. This can help reduce swelling and soften the skin, sometimes allowing the nail edge to grow out over the skin instead of into it. Elevation can help reduce swelling and throbbing pain. Topical antibiotic ointments like Neosporin or Polysporin can help prevent bacterial infection in minor cases. But here are the red flags that mean stop home treatment immediately and call your podiatrist immediately. Increasing pain instead of improvement after 2 to 3 days. Spreading redness or red streaks, pus or foul-smelling drainage, fever or feeling unwell, and if you're diabetic, don't attempt home treatment at all. Never attempt bathroom surgery. Trying to dig out the ingrown nail edge with nail clippers, tweezers, or other instruments. This almost always makes the problem worse by creating additional trauma and inflammation, introducing bacteria and causing infection, and leaving behind sharp nail fragments that continue to grow into the skin. And you could also damage the nail matrix and cause permanent nail deformity. Let's talk about professional treatment options, starting with conservative care. When you come into my office with an early ingrown toenail, I can often resolve it with conservative trimming and lifting. I carefully trim away the ingrown portion of the nail. If there's mild infection, I'll prescribe topical or oral antibiotics to clear the infection before addressing the nail itself. Now let me tell you about a revolutionary treatment that's changing how we handle ingrown toenails, the Onyfix nail correction system. Onyfix is a completely pain-free, non-surgical treatment that actually corrects the underlying problem causing the ingrown toenail. Here's how it works. The nail is widest at its base. For people with ingrown toenails, the nail is often too wide for the nail bed, which causes it to curve as it grows. Onyfix provides support to the nail as it grows, preventing it from curving and becoming ingrown. The procedure is simple. We apply a composite material to the base of your toenail. It feels like getting your nail done at the salon. The composite is then hardened with an ultraviolet light, creating a flexible brace that supports proper nail growth. There's no cutting, there's no numbing, there's no pain, and there's no downtime. You can immediately resume all activities. The system can be used on diabetics, on women who are pregnant, and even on young children. In fact, it's a game changer for children. For cases where there's acute pain, I may apply an additional strip of the composite about 2/3 of the way down the nail. This gives the nail some lift and provides immediate pain relief. We typically follow up in 6 weeks and may apply additional applications to keep the nail growing and correct the direction. The results are remarkable. Patients often see immediate pain relief and long-term correction of the underlying problem. For severe or recurrent ingrown toenails, we have permanent surgical solutions. Partial nail avulsions involves removing the ingrown portion of the nail under local anesthesia. The procedure takes less than 5 minutes, and the only discomfort is from the numbing injections. For recurrent ingrown toenails, I can perform a matrixectomy. This involves applying a medication to the base of the nail that permanently prevents the portion of the nail from growing back. This is a permanent solution. The treated portion of the nail should never grow back, so you'll never have an ingrown toenail in that spot again. The rest of the nail continues to grow normally, and the cosmetic result is excellent. Now let's talk about prevention, because preventing ingrown toenails is much easier than treating them. Proper nail trimming technique is absolutely critical. First, timing matters. Never cut your nails when they're wet or soft from a shower. Wait at least 2 hours after bathing, or cut them when they're completely dry. Second, use the right tools. Professional grade straight across toenail clippers, not curved fingernail clippers. Third, cut straight across. Don't follow the curve of your toe, and don't cut into the corners. Leave about 2 millimeters of white showing. Fourth, follow the edges to smooth any rough spot, but don't put a file in the corners. Proper footwear is just as important as proper nail trimming. Your shoes should have a wide toe box that allows your toes to move freely. The general rule I give patients is that you should have the width of your index finger between your longest toe and the end of the shoe. Avoid narrow shoes, pointed toe shoes, and high heels whenever possible. If you must wear them for work or special occasions, limit the time you give your feet breaks. Athletic shoes should be half size larger than your regular shoes to accommodate foot swelling during activity. Avoiding trauma means being mindful of activities that put your toes at risk. In sports, make sure your shoes fit properly and your toenails are trimmed appropriately before activity. Around the house, wear protective footwear when doing yard work or moving heavy objects. Be careful in crowded areas where someone might step on your toes. Let me share some special considerations for high-risk groups. Diabetics should never attempt to treat ingrown toenails at home. The risk of serious infection is too high, and the consequences can be devastating. Daily foot inspection is crucial. Look for any sign of redness, swelling, or nail problems. Elderly patients may have difficulty seeing or reaching their feet to perform proper nail care. Regular professional nail care isn't a luxury for seniors. It's preventative medicine. Athletes need to be particularly vigilant about proper footwear and nail care, given their high risk of trauma-related ingrown toenails. Let me tell you about a success story that illustrates why intervention matters. I had a teenage patient, let's call him Jake, who was a soccer player. He came to my office with what he thought was a sore toe. It had been bothering him for a few weeks. His parents almost didn't bring him in because it seemed minor. When I examined Jake's toe, I found an early ingrown toenail without an infection. We caught it just in time. A few more days and it would have required surgical treatment. I applied the Onyfix system to correct the underlying nail curvature, and within a week, Jake was pain-free and back to playing soccer. 6 months later, his nail was growing perfectly straight with no recurrence. The key was early intervention. If Jake had waited another week or two, or if his parents had tried to treat him at home, he would have needed surgical treatment and missed significant playing time. What about prevention for people with genetic predisposition? If you have a family history of ingrown toenails or naturally curved nails, you're not doomed to suffer. The Onyfix system can be used preventatively to train your nails to grow in the correct direction before they become ingrown. Regular professional nail care can also help identify and address problems before they become painful. Let me give you action steps you can take right now. First, examine your toenails. Look for any sign of redness, swelling, or tenderness along the nail borders. Second, evaluate your nail trimming technique. Are you cutting straight across, or are you rounding the corners? Third, assess your footwear. Are your shoes squeezing your toes or putting pressure on your nail edges? Fourth, if you have any sign of an ingrown toenail, don't wait. Early treatment is always easier and more effective than waiting until it becomes severely infected. Fifth, if you have risk factors like diabetes, circulation problems, or a family history of ingrown toenails, establish a relationship with a podiatrist for preventative care. Common myths I need to address. Myth: cutting a V-notch in the center of the nail will prevent ingrown toenails. The truth: it does absolutely nothing, and it may weaken the nail. How about this myth? Ingrown toenails always require surgery. The truth is, with modern treatments like Onyfix, many ingrown toenails can be corrected without any cutting or surgery. Another myth: you should dig out the ingrown portion yourself. The truth is, you almost always make the problem worse, and can lead to serious infections. Ingrown toenails cause unnecessary pain and suffering for millions of people, but they don't have to. With proper prevention techniques and modern treatment options, you can have healthy, pain-free toenails. If you found this information helpful, please hit the like button and share this video with anyone who's dealing with ingrown toenail pain. Your share can help someone avoid serious complications. Subscribe to the channel and follow me on social media for more evidence-based foot health content. The links are in the description. Don't forget to get your free copy of my toenail health book at www.mytoenailbook.com. It includes detailed prevention strategies and treatment options for ingrown toenails. If you're dealing with ingrown toenail pain, don't suffer needlessly. We have pain-free treatment options that can resolve the problem permanently. Contact our office to schedule an evaluation. The link is in the description below. Remember, that tiny corner of your toenail doesn't have to control your life. With the right approach, you can prevent ingrown toenails and enjoy pain-free feet. Thanks so much for watching, and have a great day.